Thank you. The specific time frame is also very helpful. I'm the Healthcare Advocacy Advisor for the Estonian Chamber of People with Disabilities. My name is Tuuli, and it is my pleasure to tell you today about patient organizations in Estonia under a different angle. And we were already talking among ourselves to take on the offer extended to us by the previous speaker to get involved internationally. But to the topic at hand, I looked at what our beliefs are about what we can do. We got a proverb in Estonia: want a lot, you get little; you want a little, you get empty hands. Meaning we need to set our goals high. There is another proverb, slightly more negative. Nobody slaps the mouth of one asking, meaning you should ask, nobody will hurt you for this. And the third one, many voices together is a crowd, one voice is nothing. Meaning patient organizations can amplify individuals' needs. But what do we need a crowd for? This needs no explanation. I believe people who have had a first-hand experience with rare diseases need no explanation. Later missing diagnosis, discrimination, stigma, there is limited access to services, there is medical gaslighting, there is regional inequality, and there's something called medical gaslighting. What is this? Our patient surveys have shown that when people have a slightly more complicated diagnosis, rare diseases, then first of all, the journey to the diagnosis is complicated, but then later, when they have secondary symptoms, new issues, and these are first ascribed to the rare disease they already have diagnosed, and even the following experience with the healthcare system may be difficult. This doesn't only concern children, but adults alike. But now on to patient advocacy organizations. There's two aspects to this. First of all, the supportive shoulder of a fellow patient in a similar situation. And the second aspect is patient advocacy. The strong shoulder is important when you are diagnosed and you got somebody who you feel really understands you. Even though every case is different and every patient is different, then full understanding can only be had from somebody, whether a patient or a loved one who has been there themselves. Somebody who has experienced the full depth of the suffering and possibly has found solutions or shortcuts that I could spend a long time looking for. Because the era we live in, on the one hand, there is a lot of information flooding us. On the other hand, it's difficult to verify and to sort the truth from the non-truth. A patient organization could be a magnifying glass and a megaphone at the same time to let us explain what it means to live with a rare disease, to describe the lived experience of living with the disease. passing on this information and standing for the needs of the patients is what the crowd can do. But in Estonia, we are a small country, and some rare diseases may have just a single patient in Estonia, and most people won't have heard of the disease. It's difficult to create an association based on a single patient. But the Estonian Chamber for People with Disabilities is an umbrella organization for numerous smaller associations. And we reach out to people who are not immediate members of our network, but who have collaborated with us, who are with us. I will tell you more about what being a crowd means in our context. We have diagnosis-based groups. Those are few for rare diseases specifically, but within larger organizations, we got smaller cells, so to say. Let's say a myasthenia cell within the muscular disorder association. We have the lupus association, meaning smaller cells within larger organizations. We got Facebook groups, some public, some closed, where adults and adult sufferers of rare diseases can can exchange information. We got an oncology rare cancers group. It's an excellent example of network building and providing emotional and informational support to fellow patients. These networks always include specialists, because sometimes when you don't know what you don't know, then it's difficult to find your way in the swamp of information. And it would be easy enough to go astray and buy cheap promises for expensive money. And as we heard previously, there are major international networks as well as smaller patients groups. But now, what do we at the Estonian Chamber of People with Disabilities do to advocate for patients? We advocate for our problems in the media. We highlight the problems. We take the fight to a wider societal level. And this is a fight for all people with all rare diseases. Slide displays some of our last year's media appearances, and this is work we continue at all times. We work with many different parties. Just last week, we had a meeting with the Health Insurance Fund, with a Pharmaceutical Manufacturers Association, and we discussed ways to have patient input for the drug committee meetings, where patients could provide the decision makers with input about how the drugs they take affect their everyday lives and what they would like to see happen. Another topic we work with is accessibility. This can be especially important in the context of rare disease. This can make the difference between whether the mother of a child with a rare disease can have a life outside home at all, whether they can equally to other families go out, take part in public life, take part in society, take part in their other children's schooling. support their other loved ones. And this is an important topic we all keep in mind in our work, in the design of various processes as well as buildings. Another topic we work with is caregiving. Caregiving can change a person's life course entirely. If suddenly you have to dedicate all of your time to taking care of a loved one, then the confusion and the burden can be vast at first. In an Estonian children's movie, there's an example of a little creature peeling carrots in a carrot peeling machine until complete overwhelm. A similar overwhelm can happen in your caregiving journey, where at some point you can't see beyond your immediate point of view. You simply tread water trying to survive, but it's like pushing a handcart with no wheels uphill. We got a website regarding caregiving, omastehooldus.ee. I would recommend everybody to get acquainted with it. It includes a lot of information on how to go through the caregiving optimally. We got guidelines on how to reach the services you need. The website includes other information as well, even if these topics are not directly relevant to you. Furthermore, we are actively involved in national policy making. We provide input to legislative activity. Then the Estonian Agrenska Foundation. Our chamber was one of the founding members. They organize theme days for families of patients with specific rare diseases. Here's an overview of diagnoses that have been involved. And from this summer, we will provide a full kindergarten or child caretaking service. We also organize events. This very Sunday, there will be a conference-like event concerning the well-being of adults with rare disease. Since the 8th of March is the Women's Day, we talk about 2 women with combined complex diagnoses and their journeys, the battles they have fought, how to be a woman, how to break taboos, how to retain your joyfulness and strength. I recommend viewing this on YouTube. It starts at 10 a.m. Sunday, and it's got accessibility support. But one more slide. Patient organizations in Estonia are based on our energy, the energy of the people in those groups. And thinking about the number of hours available in the day, you all know, don't you? You all whisper 24 hours in a day. People with rare disease, caretakers of children with rare disease have fewer hours available to them. Deducting 8 hours of sleep, let's say healthy individual or somebody with a light disorder will still have 16 hours. If you have a rare disease or a severe chronic disease, it might take at least 2 hours out of these 16 simply to rest. or it might take 6 hours for caretaking activities, or for doing physiotherapy for your child, or to take your child somewhere, or perhaps do the activities your own health needs. The majority of Estonian patient advocacy organizations is based on goodwill and voluntarism. They are led by people who have either serious disorders or a high caregiving load. And even though volunteering is a sign of a good, well-functioning society, we still need to think about how to provide support, provide funding, so that these people whose time is more limited than the rest of ours could handle their affairs, to be able to take part in a workplace, to be available for their families, and to still be able to support one another as patients. Kindness, inclusion are choices. They are decisions we make on a daily basis. And this image with a teddy bear at breast comes with a small story. This is an unpaid reading recommendation. Letters for one and everyone. Animals, who has their birthday today? If nobody, then who wants to celebrate their birthday in advance? If still nobody, then who wants to celebrate something else and invite me over for cake? If there's still nobody, then who wants to just bake a cake? In parentheses, with plenty of honey and whipped cream and sweet sugar frosting. And please invite me over to help you eat. And if there's nobody, then what happens then? Do you know what collapse means? This is what would happen to me. Help me, teddy bear. This evening, everybody celebrated their birthday. They celebrated their birthdays in advance. They celebrated something else, but definitely they baked cakes. The teddy bear visited one after another until the teddy bear could no longer keep going, sat down by a large tree and fell asleep by the setting sun. So let's be inclusive. Let's be as kind as the teddy bear. Let's be a crowd. Let's raise our voices like the bear did. And if the other party is willing to bake cakes, even without a specific reason, then for the teddy bear or for the patient of a rare disease, then I believe as society we will get to a better place faster and in a more joyful way. Because the joy of giving, the joy of kindness, is something that spreads when it is spread. Right? Thank you. Thank you. Health advocacy person of the Chamber of People with Disabilities. How could the state of Estonia support and empower organizations in Estonia? Right, this is something I would like to know as well. Currently, the Estonian Chamber of People with Disabilities is a strategic partner of the state. But there's a question, what kind of strategy is it that spans a single year? But our partnership lasts a year. So a long-term plan is needed to let us thoroughly consider what we can do to move forward. And any state funding, any support at all should for patient organizations should be granted. What could rare disease patients organizations do to have a more fruitful collaboration with the Chamber of People with Disabilities? Please get in touch with us. Let's review together the goals we want to achieve. What is realistic? What we can actually get done? So this would be a start, and the journey would begin there. Currently, we do our activities to support the general water line for people with any diseases, but for more specific matters, this should be discussed and decided. How to ensure that small and specific organizations for rare diseases don't go without support? This is difficult. If you have financial support in mind, then we have clear conditions on how our members of our network receive grants. So learn the conditions. They are not very complicated. It is my pleasure to see that members of our networks have gone to the media themselves. There have been some excellent publications. There is people with us who have published good articles on healthcare services. People with disabilities have written about their experiences. So I would suggest to get acquainted with our conditions, get in touch with us, and create a plan together. What does it take for a patient advocacy organization to function really well and for the crowd to achieve results? A lot depends on the people, on their strength, on their activity level, on how to approach making noise. If it's simply diffuse noise, it won't go far. There should be a clear plan, clearly defined steps, and I can say that collaboration with the state and its bodies has improved. We are now able to discuss what we can do straight away, what we can get done in the longer term, and how to move forward. In other EU countries, there is more support because the grassroots initiatives have a wider reach than top-down initiatives. How about Estonia? Is there a longer-term funding perspective? As I said, we have a strategic partnership with the state for 1 year. In our view, it's not possible to achieve longer-term goals in this time frame. Of course, we have longer plans in the pipeline, but it takes a social agreement and political willingness. State patient organizations, their voice, their inclusion, their presence in various committees is important for us. It goes beyond checking the boxes of patient inclusion on paper. It has to be actual collaboration, and patients have to have previous training on how to give functioning input. On the other hand, they have to see that their input gets feedback. And we see that this work is producing fruit. How could the Chamber of People with Disabilities support the creation of organizations of rare diseases? And with us, let's discuss it. There's no need for a long discussion in years. Let's come together. Let's clearly define the needs. Let's create a plan of action and start executing it. Our motto has been recently that move fast and break things, or act first, think after. to avoid a standstill. Tuuli Seinberg.